I hope I have not left anyone out, but certainly thank you so much for joining us. What a day for us as a sector when we are celebrating the strides that we have made in the HIV sector against stigma and discrimination, which is a critical component of the work that we do. I think when we look at stigma and discrimination and the impact that it would have had on those living with the virus and those who are affected by it, we're talking about persons not having access to treatment, persons not having access to the prevention services which are critical for them. And then we're also talking about when rights are violated, there are difficulties in getting access to justice. Now, Mr. Javian Nelson will be guiding us through the 2020 annual report that the sector collectively would have made a lot of work and efforts around. So we're talking about training of police officers, training of our healthcare sectors, and of course, forefront to all of this are persons who are within the communities, ensuring that they have a voice in what would have put forward. So at this time, I'm going to turn over to Mrs. Manova, who would give us her greetings on behalf of UNAIDS.
Thank you, Mikel. Good morning, colleagues. Good morning, friends and key stakeholders. It is really my great pleasure to welcome you today to launch of the National 2020 Annual Human Rights Report, Enabling Environment and Human Rights Report. That report describes the progress of the programs to reduce HIV-related stigma and discrimination and to improve access to justice for people living with HIV and most affected by HIV in Jamaica. In addition to that, it gives the main achievements in promoting an enabling environment and protecting human rights, and describes the lessons learned and the best practices. And most importantly, gives us some insights on the way forward that are very critical for our future initiatives. And secondly, I think that today we collectively make use of the opportunity that this launch is happening just 4 days before the high-level meeting of the General Assembly on AIDS that will start on 8th of June and will be the 5th one since the start of the epidemic, to make a call on Jamaica in particular to further accelerate the progress and to get back on track on the road of ending AIDS and to commit to the targets in the new political declarations that will be adopted next week. I want to say that we, the UNAIDS team in Jamaica, strongly believe that AIDS in Jamaica is not over, but it can be. And just yesterday, UNAIDS released its global report called Global Commitments, Local Actions. And this report has a data that shows that dozens of countries have already achieved the 2020 targets. So there is evidence that the targets were not just aspirational, they were achievable. However, we also have the data that many countries, including, unfortunately, our beloved Jamaica, and also entire regions, are completely off track. And within these countries, what the data shows is that the most vulnerable, the key populations, are the ones that are left behind. And here, HIV remains driven by inequalities. And that's way for us to get word back on track. We as UNAIDS and the global AIDS community have used an inequality lens and developed a new and ambitious global AIDS strategy that will guide us in the next 10 years towards the ending AIDS in 2030 but also sets a very ambitious and new targets for 2025. And some of them are specifically on enabling environment and human rights. And I just want to conclude with an important message that comes again from the latest report, is that the countries with progressive laws and policies, the countries with strong and inclusive communities health system, they have the best HIV and AIDS related outcomes. It means that the new infections are reduced faster and the AIDS related deaths are also reduced faster. So that's what we would like to achieve with our work, with the global partnership, and with the support of our colleagues and our dear Shannon, Executive Director. I really think that that's also the time to thank you, Shannon, for the great support you have been personally giving us in the implementation for the partnership in Jamaica. Thank you very much. And I just want to say one last sentence. I don't know from where I picked it, but it's really lovely that only rights will stop the wrongs. So, Mikel, over to you to be our master of the ceremony in this lovely event.
All right, thank you, Mrs. Manova. So there's a video, please. Yes, go ahead, Javian.
Isn't a death sentence. Would you believe me? Well, you should. Because I have been living with HIV for over 21 years, employed in a happy relationship and living positively. We know that HIV don't have a face, but if it must, the glow that you see here is because of me being able to live positively. So, if you have a friend, a loved one, or even an acquaintance who is living with HIV, don't make it hard for them. Love them, encourage them, and support them so that they can live positively.
Okay, great. What a wonderful video that we have just seen. I see, Mrs. Manova, you have a comment?
Yeah, just one thing. And of course, I just want to extend my sincere gratitude to the State Minister for agreeing to lead the partnership. And thank you so much for being with us today. And thank you for your leadership and commitment.
All right, thank you so much. I think with that said, before we move on, we want to just briefly contextualize why we're here. The Jamaica Partnership to Eliminate All Forms of HIV-related Stigma and Discrimination is an initiative of the UNAIDS Jamaica. And I think when we look at that purpose, Javen will be leading us through the efforts of the committee. But central to that would be catalyzation of leadership, meaningful partnerships, and measurement of accountability. But underpinning all of that is the fostering of ownership, not only among civil society organizations, but as we have seen in that video just now, among the persons that we are here serving, because that's exactly what we're doing. Mrs. Manova also spoke about partnerships and the Minister of State's commitment to this, and she is the chair of the partnership, and we must extend our appreciation to Minister Juliet Cuthbert-Flynn. I'm not sure she's in a position at this moment to speak, because we could turn over to you at this time, Minister.
Good morning, all. I'm having a few challenges. As we all know, internet challenges, computer challenges this morning. However, we must continue this very important topic on enabling environment and human rights. And it was really a pleasure for me to be here this morning to be chair of this, especially with the annual report. I read it, and I think we have done so much work, and much more work is yet to be done here in Jamaica. But it's really a pleasure. So Moderator Mikel Jackson Jamaica AIDS Support for Life, Dr. Shannon Hader, Deputy Executive Director of UNAIDS, of course, Miss Manoela Manova, UNAIDS Country Director, Mr. Jumoke Patrick, Executive Director of Jamaica Network Seropositive, Dr. Alicia Robb Allen, who's a Senior Medical Officer at the Ministry of Health and Wellness, Devon Gabriel, Director of Enabling Environment and Human Rights in the unit of the National Family Planning Board, Mr. Javon Nelson, who is a consultant, UNAIDS for Jamaica, and all distinguished guests, ladies and gentlemen, and members of the media, a pleasant morning. Again, as I said, I'm having a little challenge, some challenges, so I've had to use my phone. Hence, I'm not sure if everyone can see properly, and I'm going to just try to do my best this morning to make sure that I bring across the message from the ministry and the government of Jamaica. So again, you know, as we all know, the 2020 Worldwide Agenda for Sustainable Development is grounded in the Universal Declaration of Human Rights and international human rights treaties. And so the Ministry of Health and Wellness is championing this cause by taking a supportive, stigma and discrimination-free environment for all Jamaicans. We must ensure that all Jamaicans have their human rights protected. And so it pleases me to be a part of this launch of the UNAIDS 2020 Annual Report for Enabling Environment and Human Rights for Jamaica. This report speaks to critical aspect of our national HIV/AIDS response and showcases our collective work in reducing barriers to access care for all vulnerable population. This report also demonstrates how vital partnership is in the public sector. And so as such, I wish to record the government's sincere appreciation to all of our public healthcare team, to our civil servants, organization, and of course, our international partners who are with us on this journey to a safe and enabling environment for all. Tremendous investments have been made over the years. And so the government of Jamaica has done much work with civil society organizations, also faith-based organizations, international development partners, to mitigate HIV-related stigma and discrimination in Jamaica. But despite these investments, HIV stigma and discrimination still exists among population of people living with HIV and AIDS who are the most affected, with this vulnerable group being sex workers, homosexuals, bisexuals, other men who have sex with men, inmates, transgender persons, young girls, adolescents, and youths, and how society seems to muffle their voices. It is no wonder we see what is happening, and it's a critical factor affecting how they access needed medical care, or if they access medical care at all because of the stigma and discrimination. And so while these challenges persist, all of the partners work in the HIV response, particularly last year amid the COVID-19 pandemic. It gives me a lot of hope about the possibilities for the future. The government of Jamaica is committed to accelerating the progress to end HIV/AIDS as a public health issue through revitalized multi-sectoral response that protects, promotes, and fulfills the human rights of all Jamaicans, including the most vulnerable and marginalized in our society. And so in 2020, Jamaica became one of the first countries globally to endorse and to participate in partnership to eliminate all forms of violence, all forms of HIV-related stigma and discrimination. Our Jamaican partnership of the ministry is a key partner, and which I have the honor of chairing. And I hope that we can, with this, we can able to strengthen the tremendous efforts made by civil society, government, the international development partners, and other stakeholders. The partnership provides us with a platform really to design and to implement and monitor our efforts to end stigma and discrimination in all settings. And this is really what we want to see the outcome. The thrust to mitigate stigma and discrimination in all settings and end HIV/AIDS in Jamaica ongoing process. The achievement of our target depends on addressing the social and also the legal highlighted that serve as barriers. And this is imperative as we strive to allow every individual, regardless of their occupation, their socioeconomic status, their sexual orientation, their gender identity, age, health status, their disabilities, and other status, to enjoy their human rights. We know that there's a long road ahead, but we are driven and we're determined to keep building on our achievements thus far. And the government of Jamaica remains committed to eliminating all forms of HIV, AIDS-related stigma and discrimination, and also violence. Again, our many, many thanks to our partners. And let me say a commendation to the team for compiling this very critical report. And we look forward to the continued work. I definitely look forward to the continued work on this as in my tenure, and the partnership that we strive to achieve the best outcome for all Jamaicans. I thank you so much.
Thank you so much, Minister. And we must again extend our round of applause to you, not only because of the work that you have been doing in your capacity as Minister of State in Ministry of the Health, but certainly you have signaled your personal commitment to us as a sector. And when we can reach out to a minister, as we have been able to do, amidst COVID-19 especially, again, we do give thanks. We're going to be turning over to Mr. Javian Nelson, who would have been our convener of sorts within the sector working to compile this report. And I tell you, it's COVID times. And when I had the privilege of having a preview of that report, which was compiled, and the amount of work we were able to do as a sector is quite remarkable. And center to all of this is the voice of the community. So Mr. Nelson, over to you to guide us through the achievements and the strides that we're here celebrating this morning.
Thank you, Mikkel. So very briefly, this annual report really represents the work of the stakeholders in the national response to HIV. It will showcase some of the progress that we have made, and to note that the report was done under the framework of the Jamaica Partnership to eliminate all forms of stigma and discrimination. And the contributions were from the National Family Planning Board and the Jamaica AIDS Support for Life. So just some quick information in terms of summary. So in the past year, there were at least 57 major interventions that were undertaken by government and non-governmental organizations, including faith-based entities. The Jamaica Council of Churches is an important partner in the work to address stigma and discrimination. And most activities under the Global Fund baseline assessment, which was done some time ago, fall under the program areas 1 and 5 to reduce stigma and discrimination. There were 24 interventions there, and around key populations knowing their rights and providing HIV-related legal services. As the Minister and Mikkel would have mentioned, a number of people continue to be affected by stigma and discrimination. In some cases are met with violence as well. There were only 5 interventions, unfortunately, that were geared towards engendering legal and policy reform. And the significant number of interventions were undertaken in communities, justice, and health settings. Under the framework of the partnership, we are working in terms of addressing stigma and discrimination in education, workplaces, justice, health, and humanitarian settings, as well as communities. Importantly, there were only 6 interventions and 7 interventions in education and workplace settings. The significant majority of interventions recorded in this report were undertaken by JFLAG, the Jamaican Network of Seropositives, and Transwave, which are all community-led organizations. And by community-led organizations, we mean that they are largely staffed by or headed by people who are part of one or more of the vulnerable groups for which we work in terms of the HIV response. Importantly, JASL, as the only Jamaica AIDS Support for Life, as the only full-service NGO in the response implemented 11 initiatives, and the National Family Planning Board undertook 8 interventions, and one of that is the Human Rights Campaign, which we'll mention as one of the highlights. Most interventions, about 37 of them, were undertaken with support from the Global Fund to Fight AIDS, Tuberculosis, and Malaria, which has been a significant part in the national response. The joint UN team provided financial assistance for about 10 interventions, and importantly, the government of Jamaica also contributed financial support to some of the interventions. The Human Rights Campaign has been a major part of the government's support to the Human Rights Initiative to address stigma and discrimination, and the European Union has been providing support to JFLAG and Jamaica AIDS Support for Life to address some challenging issues where vulnerable and marginalized groups are concerned. In terms of some of the highlights, just to note that I'll just share about 6. So we have the Human Rights Public Education Campaign, which I said was launched in December. This is a partnership between the Office of the Public Defender and the National Family Planning Board. And the campaign focuses on 4 rights contained in the Charter of Fundamental Rights and Freedom and the Universal Declaration of Human Rights, and it is funded jointly by the Global Fund and Government of Jamaica. We were able to do a lot of sensitization on human rights despite the pandemic. 115 police officers and correctional officers were trained by Jamaica AIDS Support for Life. 348 healthcare workers were sensitized by the National Family Planning Board, and a total of 450 faith-based leaders and their congregants were sensitized on human rights by the Jamaica Council of Churches. In terms of access to legal support for people who are living with HIV and who are affected by HIV, about 98 people benefited from support in this regard. They would have gotten legal advice or representation to address the violation of their rights. And we were able to, with the support of the Jamaicans for Justice, reach a resolution in 18 of the cases. And then civil society organizations led by the Jamaica AIDS Support for Life worked collectively to develop a model anti-discrimination legislation, which they plan to present to legislators this year for adoption. And they've been doing significant work in this regard. And then something that I think as a country we can be very proud of, despite the challenges that we have where laws and policies are concerned, Transwave Jamaica, the only transgender-led organization in the country at this time, with technical support from UNAIDS and the United Nations Population Fund, and in partnership with the Ministry of Health and Wellness and University of the West Indies, launched the very first trans health strategy in the Caribbean. And the strategy seeks to guide efforts around addressing and providing services for transgender persons and persons who are non-gender conforming. And then lastly, the National Family Planning Board also reestablished its Legal and Policy Review Committee, and the committee is working on a number of submissions which they plan to send to Cabinet for review and approval to address important issues around addressing stigma and discrimination. Just some lessons learned in terms of the way forward for the national program is that we have to do more in terms of enabling environment and human rights. So we have to increase the number of people who are working in this area, and there's need for improvement in terms of monitoring, evaluation, and learning, including routine documentation and reporting of outcomes and impacts of the interventions that are being implemented. And there's greater need for more engagement of legislators and key policy and decision makers, and providing continuous trainings for healthcare workers and other duty bearers. And then lastly, work has to be done in terms of capitalizing on opportunities to engage duty bearers and law enforcement personnel before they get into services. Thank you, Mikkel.
Thank you so much, Javian. Again, such awesome work. And front to all of this are the community-led responses, the members of the communities. And I think we really have to emphasize that. I don't think there's any one initiative that Javian would have presented that the key groups that we serve would not have been a part of. So again, celebrating our strides remain the constant theme throughout this annual report that we're seeing here. Javian, at this time, will we be showing the other Live Positive video?
Big man. Front fade or side fade?
Side fade.
We trim all type of hair, short hair, long hair, or even some pepper grade. When I just see here when I trim, I see people. So if a man tests positive for HIV, that don't affect the price of my trimming. We treat people with respect. One thing we know, a man not worry about not when him sit down on my barber chair. Whether HIV positive or not, we're going to treat you with the same love and respect. Live positively.
Live positively. Great. All right. You know, so big up to Mario and persons like Mario who are allies, and we must, you know, it's a video, but certainly it's the mantra that we are pushing, and we're encouraging all Jamaicans to live by. Live positively, show our support to persons living with HIV. At this time, we're going to turn over to Dr. Shannon Hader to just guide us through for the next 5 or so minutes around sharing with us what she's doing and giving our keynote presentation. Over to you.
Oh, thank you, Mikkel. It's such a privilege to be here with you and these honored guests, all protocol observed. And I just want to start by saying UNAIDS worldwide, I think, recognizes the continued commitment by the government of Jamaica to eliminate all forms of HIV-related stigma and discrimination, and we commend you for your leadership. You've heard a little bit about the global partnership, but I must say, when UNAIDS helped form the Global Partnership to End HIV Stigma and Discrimination, this is convened by United Nations partners, by the Global Fund, by civil society. We intended to support governments to take concrete evidence-based actions to end HIV stigma and discrimination. And this isn't just a slogan. When governments sign up to this partnership, they commit to building on existing national efforts and to take action in at least 3 of the 6 settings of stigma during the very first year, and to expand action to all 6 settings over the next 5 years. To date, we've had 19 countries officially join and commit to the partnership. And we recognize, as was mentioned earlier, that Jamaica was among the very first to commit. So we do want to recognize and thank the Minister of State, the Honorable Juliet Cuthbert-Flynn, for her leadership, including chairing the partnership. In addition, we commend the Ministry of Health and Wellness and the National Family Planning Board on their leadership and work over the years. This annual report being launched today is evidence of the strong commitment, collaboration, and hard work being done in Jamaica to promote human rights and end the AIDS epidemic. The report itself and the commitments it contains are specific, and they are impressive. Second, I want to highlight that in our recently adopted Global AIDS Strategy for 2021 to 2026, titled End Inequalities, End AIDS, we formally recognize that societal enablers and HIV outcomes are linked, that we will only end AIDS if we strive to respect, to protect, and to promote the rights of everyone, everywhere. This is not just a right or a principle thing to do, which it is. It's also an evidence-based thing to do. The benefits of having enabling legal and societal environments actually help reduce new infections and HIV-related deaths beyond that we gain from service coverage alone. In fact, it seems like services become more effective and are most likely to be used by those people who need them most when they're in these positive environments. We've done a couple of analyses to really look at the data and do some modeling. One example, condom use. As condom use by men at the last high-risk sex increases, countries with favorable societal environments reap stronger and steeper declines in new HIV infections. Likewise, we looked at treatment coverage. As antiretroviral therapy coverage increases, even when you're getting to high levels, countries with the most favorable societal environments will see larger declines in AIDS-related deaths compared to countries with the most unfavorable societal environments. We also looked like, well, what happens if we fail to act on these societal enablers? And we calculated it will undermine our investments and our efforts to reach the HIV service targets. The result will be an excess 1.7 million AIDS-related deaths beyond what we'll otherwise have, and in excess 2.5 million additional new HIV infections by the time we reach 2030. And that's why, for the very first time, this new global strategy includes specific, measurable targets to address supportive legal environments and access to justice. Next week's UN high-level meeting on AIDS is a historic moment for the world to recommit to the HIV response and to recognize the importance of these new targets as well. We're calling these targets the 10-10-10 targets. They aim to have fewer than 10% of countries or individuals facing legal or social impediments in the following 3 areas. Less than 10% of countries have punitive legal and policy environments that deny or limit access to services. Less than 10% of people living with HIV and key populations experience stigma and discrimination. And less than 10% of women, girls, and people living with HIV and key populations experience gender inequality and violence. And we know what has been extremely important about the previous high-level meeting commitments has been that member states monitor and report on their progress against these commitments. So I'm especially encouraged to see Jamaica working on a new online reporting dashboard. This is exactly what we need to ensure that HIV data are strong, pertinent, timely, and importantly, available to use. This is the kind of thing we need to be seeing everywhere else. So I do hope and I ask the MOHW to ensure your dashboard includes these new UNAIDS targets as well. So congratulations on today. Congratulations on a year of extremely hard work for the partnership. And I look forward to what is to come next from Jamaica. Thanks.
Thank you. I mean, if we were face-to-face in a room, we would be extending our standing ovation. But thank you so much for the presentation and sharing that this is not just a Jamaica partnership, but this is a global initiative of the UNAIDS. And of course, we do give ourselves a little pat on the shoulder that we were among the first to sign on. So we appreciate that. We are going to go into a little Q&A section. I know we have members of the media here, and once we give the other 2 persons an opportunity to speak, then we will take questions from the media and certainly the other attendees that we have. And we do have the Q&A section. So I think you can just press Q&A and type your questions in, and I will field them to the other parties that will be speaking. And when I say other parties, we're talking about Mr. Jumoke Patrick, the Executive Director of the Jamaica Network of Seropositives, as well as Mr. Devon Gabriel, the Director of the Enabling Environment and Human Rights of the National Family Planning Board. Good morning to you both.
Hi, everybody. Good morning. Good morning.
Right.
Good morning.
Okay, so Jumoke, I think we can start with you. Just indicate to us, I think the first thing is, let me restructure this. Front and center, we have been saying would be the community members, persons living with HIV, persons of the other key population groups, trans community members, gay men, female sex workers. Those are the persons that we're talking about. Those are the persons that we're working with. Can you just indicate to us how the Jamaica Network of Seropositives support and how they lead their membership in charting the way of their own issues for all of us who are all affected by HIV? And I use the word us deliberately because at all times of the response, we have to ensure that we're inclusive, because HIV touches on every single member on this call and certainly every Jamaican. So Jumoke, just go ahead by just explaining how JN Plus charts the way in ensuring that persons living with HIV, persons affected by HIV are front and center in the response.
All right, thank you, Mikkel, and thank you for the organizers and everybody involved in this conversation, and congratulations to Jamaica as a partner in the global partnership and where we are and what we have achieved over the year, and one of the first countries to sign on to the global partnership. So kudos to Ruben and the team, and Manuel and the team from UNAIDS and the Ministry of Health and Wellness with the State Minister here for leading us as a country. And it's very important as it relates to partnership and what we can accomplish through partnership. And it's the very same thing when we talk about HIV, the HIV response in Jamaica, and what we need to do in terms of an impact, whether it's for people who are living with HIV or for persons who are affected or impacted by HIV. There's an intersectionality that is very important when we talk about the work within the response that is needed, when we talk about human rights violation, when we talk about treatment and care. Everything is connected. And so the involvement, the participation, the nuances to the conversations are very important for a successful program, for a successful response, HIV response within the country. As some of you may know, and for those who don't know, JN Plus is a community-led organization that is run by a board of directors who are people living with HIV, and majority of the staff are people living with HIV. And the core of our work is really about care and support for people living with HIV. So this is all about people living with HIV and what needs to be done to chart a way forward, working with different partners, including those on this call, to see what we can do more for the community. I'm happy that Jamaica signed on to the partnership. I'm happy that we are doing the work. I'm happy that in 2020, when there is COVID, that we did so much work. So a big congratulations. And what needs to be done as we talk about moving forward, as we talk about a way forward, is to see what else can be done, because more needs to be done in relation to getting people living with HIV, getting those communities that are impacted by HIV to live in a country, to live in a society where they're appreciated and accepted, and that also will make their health outcomes better in terms of HIV. And I'll stop there for now.
Thank you so much, Jumoke. Devon, can you just guide us through a little bit of the partnership with the other sector? We have Ministry of Labor and Social Security on the call here. We talked much about the faith-based or the organizations and the work that we're doing with faith-based leaders. Can you just guide us a little bit around how the National Family Planning Board works